Hello guys, it's Henrietta. You're welcome to my YouTube channel. And if you're just joining us for the first time, you're highly welcome. Please don't forget to subscribe, like, and share this video. So you can also leave a comment in the comment section after you watch the video and you tell me what you think or what you have actually learned in this video. So in today's video, we'll be talking about sudden infant death syndrome. I decided to make this video because I saw a post on Instagram where a woman took her 3 months old baby to a nursery home and left for work. So by the time she got back, she was told her baby had died. A lot of people were saying different things could be the reason, or probably the baby was killed there. Now, someone mentioned about this syndrome, this sudden infant death syndrome, and people who didn't understand what it actually meant said so many things to the person that made the comment about it. So I decided to make a video to educate us on the little I know about it. So this is a case. This sudden infant death syndrome is a case whereby a baby that is between the first month to 6 months, that's when it actually occurs. A baby suddenly dies, unexplainable. A baby which or people know was healthy, and all of a sudden the baby dies. That's why it's called a sudden infant death syndrome, because you don't know what really happen. So in this situation, people get confused. Some people might think it's spiritual. I've actually met someone who lost her baby, not knowing what happened. 1 second the baby is okay, and by the time she went to the kitchen and got back, the baby had died. And then she started crying and wailing, saying her enemies are actually after her. But with research, we decided to, when you do research and find out that a lot of things that could actually lead to infant death, without any reason, which this sudden infant death syndrome comes in. So doctors actually advise mothers when they are pregnant, not to smoke, because we all know generally that smoking during pregnancy, it's very dangerous. It could affect the growth of the baby, the development of the child could affect that child. So that's why doctors advise pregnant women to avoid smoking during pregnancy and even after pregnancy, because when you smoke during pregnancy, it could give that child, when that child is born, a breathing problem. Some might develop asthma, might not know it yet. Then some might have issues with their lungs. The function of their lungs will not be proper. It will the lungs will not function properly because it's due to the smoking you were asked to stop, which you didn't do. Okay, so then for other reasons, it could be where you keep the baby, where the baby sleeps. There are a lot of toys there. When you cover your baby with a blanket, just because you do not want the baby to catch cold, you wrap the baby all over with the blanket, not knowing you are putting that child's life in danger. The baby could be in bed sleeping, and you think, okay, everything is fine, let me just go have something to eat or take a nap, and by the time you come back, that baby is not breathing. Probably because when the baby woke up, the blanket was all over, and the baby struggled to get the blanket off. While doing that, suffocates itself. A lot of people do not consider that as a risk factor to this kind of situation. They think it doesn't happen that way. How can a baby suffocate himself with a blanket? It happens. And also we are advised as women that when you lay your child, you lay the child flat on his or her back to avoid them choking. There are situations whereby, okay, some people will say, I lay my baby on her tummy, and they find it comfortable. There are very different positions you can lay your child, okay, but don't make it be, in my own opinion, don't make it a very long lasting thing, maybe just for a couple of minutes, and then you change the position back. Some people will say they are trying to avoid the flat head syndrome. No, laying your baby flat is actually the best way to lay your child. According to medical professionals, it's actually the best way to lay your child. And putting them flat on their tummy for too long could lead to choking, suffocation, and different things that we may not know of. So it is important to do these things. And also, when you keep your baby, check on them regularly. Check on them regularly. It is very, very important, because babies like to roll and move about once they are awake, even when they are asleep. Please check on them. It is very, very important. Always place them on their back. Keep your baby's head uncovered. And if you are covering them with a blanket, let the blanket reach just the shoulders. Don't make it up to the head, because it could lead to suffocation, and then the baby could die because of lack of oxygen. Make sure the mattress your baby is using is a very comfortable one, okay? A mattress that is firm and flat, not the type of mattress when you put your baby on it, the baby becomes uncomfortable on it and thereby starts struggling and also finding it very difficult to sleep properly. So I just want to educate us out there that there is something called a sudden infant death syndrome. Not everything is spiritual. No, I actually know of someone that while she was pregnant, she smoked heavily. When I say heavily, it was as if before she got pregnant, she wasn't even smoking. Was pregnant, the smoking was so bad, so bad. And when she's advised to stop, she tells people nothing is going to happen, nothing is going to happen. And by the time she gave birth to her baby, the baby had very difficult breathing. You could be 2, 3 feet, 4 feet away and hear the sound of the baby's breathing. And when advised to take the baby to the hospital, she did not listen. Eventually, the baby died. She never accepted it was due to her smoking. She said her enemies were after her, which is wrong. It's wrong. It's what you actually did while you were pregnant. Okay, so there are a lot of things to consider when having a baby and after having a baby. So I hope that you have learned 1 or 2 things from this video, and then you also tell people about it. Thank you very much for listening to me. I do hope you subscribe and share my video. See you in my next. Thank you very much. Bye.